policy of the government to make sure that every constituency has at least a health center for. This one assists to decongest the hospitals and the referral hospitals. But it is very unfortunate that much as some of us we are celebrating from the other wing, in my constituency where even UPDF
which
was...
one? Which constituency now?
No, your constituency is still Igara West because I'm still representing them up to the end of May. So, Right Honourable Speaker, it is very unfortunate that in my constituency, government had actually brought contractors on site, the UPDF, whom they've been singing they are so effective, but I'm yet to see because they normally sit here and I've never seen them anyway. But anyway, Right Honourable Speaker, the point I'm bringing, as government is planning to upgrade other hospitals, how about other constituencies without even a single health center for? So my prayer, Right Honourable Speaker, is that this government of ours, are you writing, Your Honourable Bahati? Okay, this government of ours must pull up stockings, because you can even see the bench, Right Honourable Speaker, is empty, almost empty, to make sure that our views can be taken up. So my prayer is to make sure even constituencies that are not yet accredited with health center force, it is our right. We are seeking your favor, because we have also a connection. You can be also a Muramu, all the way from the other side, to make sure that we also get that favor. I thank you, Right Honourable
Speaker. Members, I did not give any favor. It is government responsibility to ensure that it delivers what is expected in terms of service delivery, the hospitals, the schools, the roads, all those things. My work is just to chair this house. When you're making appropriation, I chair when you're making appropriation for the good of this whole country. And I will never tell you that let's appropriate for where I come from first. No. I do not look at where I come from first. Okay? Yes, Ethel?
Thank you so much.
Seriously, Honourable Minister, we need to have a comprehensive study on issues of health care, where you have a sub-county that does not even have a health center for, a county which has no health center for. We need to look at that and see how we can make priority in the next budgeting season.
Thank you so much, Right Honourable Speaker. Right Honourable Speaker, last financial year, we agreed as Parliament, and we even appropriated that 80 billion to ensure that the health center force are catered for. And we agreed here that let's solve the matter of health, and let's ensure that health center force are well capacitated. They have at least key items to have a certain patient worked on. And we are aware that hospitals are overloaded, and right now they are overwhelmed because the health centers, from health center 2, health center 3, health center 4, because for them, they don't have that capacity to handle even almost anything. At many times, like for me, the Wakiso Health Center 4, you reach that they cannot even have certain medicines. So, Honourable Speaker, I pray, as we are thinking of how best to ensure that our hospitals, I'm saying this because a hospital like Entebbe Referral Hospital, it used to be a district hospital for Wakiso, but now it's handling 5 districts. Its capacity, staffing levels are still for district level. So many other hospitals are in the same category. Can we plan, as we appropriate this financial year, to again look at our prior program of facilitating health center for? Thank you.
Thank you. Honourable members, when I was communicating, I talked about the Women Fellowship. Now the Parliamentary, Uganda Parliament hosts the national prayers every October. That is the Parliamentary Fellowship in Parliament, which is headed by Honourable or Bahati David. And this year's national breakfast or prayer breakfast is going to be held on 8th October 2025. It will be at Entebbe, State House Entebbe at 7 a.m. The chief guest will be His Excellency President Yoweri Kaguta Museveni. The chief host is the Speaker of Parliament. The keynote speaker will be Bishop Masinde, the senior pastor from Deliverance Church, Umoja. And the theme of that day will be the power of forgiveness and reconciliation. I want to invite all of you to attend those prayers, and as we forgive each other and reconcile, really, for the good of our country. Yes, Mukatulik.
Thank you, Madam Speaker. Madam Speaker, my prayer, some of the new districts, like Kalungu, we have original hospitals under the Catholic Foundation or Church of Uganda. And when you visit Villa Maria Hospital, it has facilities better than Health Center Falls. One time I went to Zombo. There's another Catholic hospital there. But there was a policy which was helping these hospitals to run. In Kalungu, where I come from, Villa Maria Hospital works on Sembabule, works on Chiruhura.
That is the PHC.
Yes, works on Gomba. But we don't have doctors because those hospitals cannot afford paying doctors. And if a policy can be worked on, and the government can post some doctors in these hospitals, even the
Honorable Bahati, Minister, that's a very important point. There are some private-owned hospitals, like church-owned hospital, even privately owned by other people. If government can only do one thing, send doctors in those hospitals, and then they will give treatment as a subsidized rate, it would help.
Madam Speaker, as I conclude, if you go to Villa Maria Hospital, where I come from and where I was born, they have enough facilities, they have accommodation for doctors, first-class houses, but because they're incapacitated by income, based on the income of the people, they cannot, but they are seeking guidance and help from government, as you have. I'm going to give information. As you have stated, it could solve a lot of issues because already they are established and the government is giving some little money, but employing doctors, nurses is very key.
Thank you. I was waiting for Christine. Now that Christine has come, let me to have Dr. Peya, Aru, Honorable Atkins, then JB.
Thank you very much, Right Honourable Speaker, and thank you for your communication and the success.
Maybe before you speak, in the public gallery we have students, pupils and teachers from Menya Primary School from Queen County. Queen County, Queen District, you're most welcome. Thank you so much for coming. Join me in welcoming them. Thank you. They are represented by Honorable William Chemongesi and Honorable Rose Emma Sherukut. Welcome. Thank you so much for coming.
Thank you, Right Honourable Speaker. I was thanking you so much for always guiding this House in matters of service delivery. And yesterday we passed this law in a record, I think 1 minute, where there was no discussion, and we really thank you for that. That issues that affects our people is always a priority. Right Honourable Speaker, on Wednesday, I was privileged to be a minister for 1 hour when the Minister of Health delegated me to hand over an ambulance in my health center 4 in Amolatar. I took an effort to visit or tour the health center. And what I saw there is that our health centers are more sick than the patients themselves. The issue of infrastructure of our health system is really wanting. And so as a house, I think we need to reprioritize and take affirmative action, the way you are doing for sports. If only we could stand our ground, pass a budget that would do at least a minimum renovation, to the extent that even just a bed to treat the patients are not there. So the issue of infrastructure, of our health system should really take priority. I know you're a people's person. Our theme for this parliament, the 11th parliament, has been the people's parliament. I think for the next 1 year remaining, or the next few months, let us do something for the health sector. It's really wanting. I thank you.
Thank you, and we must walk the talk. Yes, Aru.
Right Honorable Speaker, thank you so much for this opportunity. But above all, Right Honorable Speaker, I'm humbled that you had to speak about health. There are individuals down there, especially in Naru, whose life will change by your speech, the Right Honorable Speaker. I thank you so much for that motherly and kind-hearted spirit. Right Honorable Speaker, in Pade District, we only have 2 delivery beds.
2
delivery beds, and they are in Pajuri Health Center 4. The last time when Minister of Health was... The last time when Minister of Health was giving out delivery beds...
You have 2 delivery beds?
2 delivery
what
beds.
What about admission beds?
Admission bed in Pajule, we have around 10 for women and 10 for men.
What is the capacity of the labor ward?
The labor ward, it takes on only 1 mother.
But if you have 2, then where do you put the other?
There are rooms for the other beds, but they cannot. Most of the mothers deliver on the floor, Right Honorable Speaker. Right Honorable Speaker, the last time...
There is a reaction from a doctor.
Thank you very much, Right Honorable Speaker.
There is a reaction to what he's saying first.
To my colleagues, health issues are very sacrosanct, like you must know, and quite expensive. Majority of us are discussing about health issues, increasing, upgrading facilities, but the most important thing is to work on the preventive aspect of illnesses.
Doctor, what we are saying, the hospitals that are there, let's have them equipped. Let's have them equipped. Let's have where there are no beds, no medicines, no doctors, no what. Let's have those.
I agree with you, Right Honourable Speaker, but I want us also, I'm alluding the House to the aspect that as long as we don't work on the preventive aspect of these patients coming to the hospitals, we shall never get there. It is also important that members of Parliament and all other stakeholders primarily do the primary prevention of illnesses.
Order. Right Honourable Speaker,
there is an
order. Right Honourable Speaker, with due respect, I respect Dr. Kagabo as a credible doctor. But Right Honourable Speaker, Honourable Kagabo, I'm not aware what he's talking about preventive. We are talking about pregnant mothers coming to the hospital. He's talking to deliver. He's talking about preventive mechanism. Right Honourable Speaker, is a trained doctor in order to mislead the House that even our women shouldn't conceive. Once they conceive, they would not have prevented themselves to deliver. Even attending family planning, they must go to the hospital.
Honorable,
is that preventive? Is he in order?
Doctor, you cannot say that the women should go on preventive. Even the Bible says that go out to the world and reproduce. So don't tell us about preventive when somebody is going to give birth. What honorable members, what Honorable Christopher is raising is a pertinent issue. on women going to give birth and there is no delivery bed. If a woman is delivering on the ground, what does it cost us to put mere delivery beds there, admission beds there? You get it, eh? These are elementary. These are very small things that a woman expects out of a hospital. Yes, Honorable.
Right, Honorable
Mr.
Speaker, thank you so much. The other issue is UPDF was given 600 million to construct and upgrade a health center 3 to health center 4. Up to date, work has stalled at 80%. That was last year when they gave the money. So we call upon government to...
No, you first go back to where the UPDF is working from, find out, get a report. What is the problem? Were they given all the money or not? Let's get a report from there so that it is on that report that we can be able to act.
Right, Honorable Speaker, they were given all the money. Money actually was sent
Okay, give me a report why they have not finished. Then we make a follow-up from there.
Thank you very much, Right Honorable Speaker. Finally, Right
Because
Honorable
we
Speaker.
need to act as leaders. Let's not start lamenting.
Finally, Right Honorable Speaker, there is a pertinent issue happening in this country. Every time there is rehabilitation of hospitals, health centers, there is a special category